Good morning, everyone. Welcome to the Las Vegas Urban League WIC Culture Club. My name is Rowena. I'm the program nutritionist at Las Vegas Urban League WIC.
And I'm Samaje Bruce, the IBCLC, a breastfeeding coordinator.
Pregnancy and Infant Loss Awareness Month is observed in the United States, Canada, and the United Kingdom, along with other countries, during the month of October. It is a month dedicated to raising awareness about pregnancy loss, including miscarriage, stillbirth, and infant death. The purpose of this awareness month is to provide support, education, and resources to those who have experienced the loss of a pregnancy or infant, and to reduce the stigma surrounding pregnancy and infant loss. During this month, various events and activities are organized to commemorate the babies who have been lost and to support grieving families. Candlelight vigils, remembrance walks, and memorial services are often held to honor the lives of the babies and provide a space for families to come together and share their experiences. Pregnancy loss, also known as miscarriage, is a deeply emotional and challenging experience for individuals and couples. It refers to the spontaneous loss of a pregnancy before the 20th week. It is important to acknowledge that miscarriage is a common occurrence and many women experience it, often before they even realize they are pregnant. It is estimated that about 10 to 20% of known pregnancies end in miscarriage, but the actual number could be higher as some miscarriages occur before a woman even knows she's pregnant. Pregnancy loss can happen for various reasons, including genetic abnormalities, hormonal issues, infections, or uterine problems. Many miscarriages occur in the first trimester, which is before 12 weeks, and they often happen because the fetus is not developing normally. Pregnancy loss, especially miscarriage, can be a complex and emotionally challenging experience. In many cases, it occurs due to factors beyond a person's control. However, there are certain lifestyle choices and precautions that can potentially reduce the risk of pregnancy loss. So some of these are: if you are planning to conceive, it is essential to schedule a preconception appointment with a healthcare provider. They can evaluate your overall health, address any existing medical conditions, and provide guidance on preparing for healthy pregnancy.
Maintaining a healthy lifestyle before and during pregnancy is crucial. This includes eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins, as well as getting regular exercise and managing stress.
Avoid smoking, alcohol, and recreational drugs. These substances can significantly increase the risk of pregnancy loss and birth defects.
Being either underweight or overweight can impact fertility and the likelihood of a miscarriage. Maintaining a healthy weight through proper diet and exercise can improve your chances of a healthy pregnancy.
If you have chronic conditions such as diabetes, hypertension, or thyroid disorders, it's important to manage these conditions under the supervision of a healthcare provider. Poorly controlled chronic conditions can increase the risk of pregnancy complications.
If you have a family history of genetic disorders or have experienced recurrent miscarriages, consider genetic counseling. This can help assess the risk factors and guide you on potential preventative measures.
Taking prenatal vitamins, especially folic acid, before conception and during early pregnancy can help prevent certain birth defects and may reduce the risk of miscarriage.
Some infections, such as rubella, which is a German measles, toxoplasmosis, and certain sexually transmitted infections can increase the risk of pregnancy loss. Ensure you are up to date on vaccinations and practice safe sex.
Once pregnant, receiving early and regular prenatal care is crucial. Regular checkups can monitor the health of both the mother and the developing fetus, allowing for timely intervention if any issues arise. It's important to note that even with the best precautions, pregnancy loss can still occur. If you experience a miscarriage or have concerns about your pregnancy, consult with a healthcare provider who can provide appropriate guidance and support tailored to your specific situations. Also, remember, it's okay to grieve and it's okay to seek help if you're finding it difficult to cope. You're not alone, and there are resources available to support you through this challenging time. We will put these resources below, and your local WIC office can provide you with referrals and support as well. All right, and then sudden infant death syndrome, which is known as SIDS, is the sudden and unexplained death of an otherwise healthy infant, typically during sleep. It is sometimes called crib death because the infants often die in their cribs. SIDS is a heartbreaking and devastating event for families as it occurs without any warning or apparent reason. The exact cause of SIDS is still unknown, but researchers believe it may involve a combination of factors, including physical factors, sleep environment, and genetic vulnerabilities. To reduce the risk of SIDS, experts recommend the following safe sleeping practice for infants. So always place your baby on their back to sleep for naps and at night. This sleep position has been shown to reduce the risk of SIDS.
Use a firm and flat mattress in a safely approved crib. Soft bedding, including pillows, blankets, and bumper pads, should be avoided.
Do not place any toys, pillows, or soft bedding in the crib. The baby should sleep on a fitted sheet, and sleep clothing like a sleep sack can be used to keep the baby warm.
It's recommended to share a room with your baby, but not the same bed. Place your baby's crib or bassinet near your bed for easy feeding and comfort.
All right. And dress your baby in a light sleep clothing and keep the room at a comfortable temperature. Overheating has been linked with an increased risk of SIDS.
Consider offering a pacifier at nighttime and bedtime. Pacifiers have been associated with reduced risk of SIDS, but if breastfeeding, wait until breastfeeding is well established before introducing a pacifier.
Whenever possible, breastfeed your baby. Breastfeeding has been linked to a lower risk of SIDS.
Getting regular prenatal care during pregnancy is important for the health of both the mother and the baby.
All right.
Awesome. In October is also Breast Cancer Awareness Month, and it is important that we conduct our self-checks and get regular mammograms and clinical breast exams. This includes men as well. Breast Cancer Awareness Month is held in October every year. It is a time annually devoted to educating everyone about breast cancer, including metastatic breast cancer and the importance of early detection and access to timely, high-quality care. The third Friday in October each year is also National Mammography Day. The event began in 1985 as a week-long event and was championed by the American Cancer Society and Imperial Chemical Industries. National Breast Cancer Foundation is dedicated to delivering comprehensive educational information on breast health and healthy living. For understanding the importance of early detection to knowing how to prepare for a mammogram, the National Breast Cancer Foundation's online resources and guide aims to empower women and men with useful information. A breast self-exam is an early detection tool that uses a combination of physical and visual examinations of both breasts to check for signs and symptoms of breast cancer. The purpose of a breast self-exam is to become familiar with the way your breasts normally look and feel. Knowing how your breasts normally look and feel, also called breast self-awareness, will help you identify any changes or abnormalities in your breast, such as a new lump or skin changes. Any changes in your breast discovered during a breast self-exam should be reported to your healthcare provider right away. While a breast self-exam is a useful tool for early detection of breast cancer, it should not take the place of a regular mammogram and clinical breast exams. We will cite the resources where you can learn more and about how to do a breast self-exam and how that should be performed. Thanks for joining us today. We look forward to our next chat with you. Remember to like and subscribe to our social media channels. Wishing you all well wishes. Culture Club out.
Bye.